The OSOM flu SARS-CoV-2 combo test is a lateral flow immunochromatographic assay intended for in vitro rapid simultaneous qualitative detection and differentiation of influenza A and influenza B nucleoprotein antigens and SARS-CoV-2 nucleocapsid antigen directly from anterior nasal swab specimens of individuals with signs and symptoms of respiratory infection consistent with COVID-19 by their healthcare provider within the first 4 days of symptom onset when tested at least twice over 3 days with at least 48 hours between tests. This video explains the procedure for using the OSOM flu SARS-CoV-2 combo test. Each kit contains 25 sterile nasal swabs, 27 test sticks in a canister, 27 extraction buffer vials, 1 flu A, flu B, SARS-CoV-2 positive control swab, 1 flu A, flu B, SARS-CoV-2 negative control swab, 2 result interpretation cards, 1 instructions for use, 1 quick reference guide, and 1 workstation. 2 extra test sticks and extraction buffer vials have been included in the kit for external quality control testing. Sekisui Diagnostics recommends that positive and negative external controls be run with each new lot, shipment received, and with each new untrained operator. Prior to running patient samples, please note the following precautions to assure accurate results. Read the instructions for use and quick reference guide thoroughly before using the OSOM flu SARS-CoV-2 combo test. Follow all warnings and recommended test and quality control procedures. Store the OSOM flu SARS-CoV-2 combo test at room temperature, 15 to 30 degrees Celsius, 59 to 86 degrees Fahrenheit, in the original packaging away from direct sunlight. Do not freeze any of the test kit components. Do not use test sticks or extraction buffer vials after the expiration date printed on the outside of the box. Note, the use-by date on your kit may be extended. Please go to sekisuidiagnostics.com/date-extensions or scan the QR code located on the kit stuffer or expiration sticker located on the front of the box to see if the dating on your kit has been extended. Recap the desiccated test stick canister immediately after removing a test stick. Test sticks that have been outside of the desiccated container for more than 30 minutes should be discarded. Inadequate or inappropriate sample collection, storage, and transport may yield false test results. The result interpretation card should be cleaned after each use by spraying the laminated card with 70% ethanol alcohol, or alternately by wiping with a clean towel moistened with 70% ethanol alcohol. The result interpretation card should be wiped dry with a clean towel. Serial testing should be performed in symptomatic individuals with negative SARS-CoV-2 results at least twice over 3 days, with 48 hours between tests. Good sample collection and sample handling are the most important first steps for an accurate test result. The following procedures are recommended for proper sample collection and preparation. To obtain accurate results, do not use visually bloody or overly viscous samples. Freshly collected patient samples should be processed in the extraction buffer vial as soon as possible after collection. If the sample cannot be processed immediately, the patient swab may be stored at room temperature, 15 to 30 degrees Celsius, for up to 30 minutes, or refrigerated, 2 to 8 degrees Celsius, for up to 30 minutes prior to testing in a clean, dry container. Refrigerated samples should come to room temperature before testing. To transport patient samples, place swab in a clean, dry container, such as a plastic or glass tube. Once the swab has been mixed in the extraction buffer vial, the extracted sample must be used within 30 minutes when stored at room temperature, 15 to 30 degrees Celsius, or refrigerated, 2 to 8 degrees Celsius. Specimen collection and testing. Only nasal swabs can be used with this test. Use of nasal washes, nasal aspirates, or nasopharyngeal swabs has not been validated. Only use the nasal swabs provided in the kit. Do not touch the swab tip prior to testing. Nasal swab sample. Gently insert the sterile swab no more than 3/4 of an inch into the nostril. Rotate the swab at least 4 times against the nasal wall. Remove the swab and repeat in the other nostril using the same swab. Sample should be processed in the extraction buffer as soon as possible after collection. Sample must be mixed in the extraction buffer within 30 minutes of sample collection. Test procedure. Twist cap off buffer vial. Insert the swab through the ridges into the liquid. Mix thoroughly by spinning the swab at least 10 times in the liquid. Note: nasal swabs may not reach the bottom of the vial. Ensure that the swab is fully immersed in the liquid when mixing. Press the swab against the side of the vial to remove any excess sample in the swab. Discard the swab. Insert the test stick, arrows pointing downward, into the vial. Set a timer for 10 minutes. Leave the test stick in the vial for the full 10 minutes. Do not handle or remove for at least 10 minutes. Read the test results at 10 minutes. Do not read the test results before 10 minutes or after 30 minutes. Note: you may need to remove the test stick to read the test results. Interpreting results. Place test stick, arrows pointing down, within dashed area of the result interpretation card included in the kit. Ensure arrows on the test stick are pointing in the same direction as the arrows on the result interpretation card, and that the results window is aligned. Look closely when interpreting the results. At 10 minutes, the appearance of only the control line is a negative result, indicating that influenza A and B viral antigens have not been detected. Invalid test result. Check to see if a line is visible at the control line CONT. If a control line is not visible at CONT after 10 minutes, even if any other line is visible in the results window, the test has failed and is considered invalid. If the test is invalid, a new test should be performed with a new patient sample, extraction buffer vial, and test stick. Negative test result. If the control line at CONT is visible and you do not see a line at S, B, or A, it means COVID-19, flu B, or flu A virus have not been detected. Negative results should be reported as a presumptive negative for the presence of influenza and/or SARS-CoV-2 antigen. To increase the chance that the negative result for COVID-19 is accurate, you should test again in 48 hours if the individual has symptoms on the first day of testing. Positive test result. If the control line at CONT is visible and any other line or multiple lines on S, B, and/or A appear, the test is positive. Note: any pink or red line, no matter how faint, should be considered an indication of a positive result. It is possible to have more than one positive test line, which could indicate a co-infection with influenza A, B, and/or SARS-CoV-2, the virus that causes COVID-19. If more than one positive test line is observed, retest with a new patient sample, extraction buffer vial, and test stick. A differing result should be followed by confirmatory testing with another test method, such as PCR. Laboratories within the United States and its territories are required to report all SARS-CoV-2 results to the appropriate public health authorities. Serial testing is needed for all samples that are negative for SARS-CoV-2 on the first day of testing, even if they are positive for influenza A and/or B. Please follow the table shown on screen and found in the instructions for use when interpreting test results with symptoms. Serial or repeat SARS-CoV-2 testing does not need to be performed if patients have a positive SARS-CoV-2 result on the first day of testing. Thank you for watching this instructional video for the OSOM Flu SARS-CoV-2 combo test procedure from Sekisui Diagnostics. Please contact Sekisui Diagnostics Technical Services at 800-332-1042 or tech services at sekisuidiagnostics.com with any questions or concerns.